Institute of Wellness is a very exciting initiative in Dona County. It has evolved over the last 4 years, and it's kind of been a slow evolution, but it's really been very organic and directed by local community health professionals who all have the same intentions of improving the healthcare system and working together in a more collaborative way. I think our county is a great size because we're large enough to have resources, but we're small enough that we can all connect. We can get our arms around all the available services. So the Wellness Institute started about 4 years ago. A couple of the healthcare leading organizations in the community came together and said, there's a lot of duplication of efforts, and there's probably more that we can accomplish if we work together. So they started meeting and talking about different ideas and initiatives. I think what really was a catalyst for the growth and the sustainability for so many years is Molina's role in helping this group come together, initially putting a lot of resources into helping with the strategic planning and helping with the organizational structure. The clinics that sit around the table look at their clients. Other organizations have an idea of the needs of the community. And again, having Molina at the table, Molina's been able to share data. So a lot of the decision making and the prioritizing, we can honestly say, has been driven by data. So we really are looking at chronic illnesses like mental health conditions, like diabetes, and how to coordinate care for people who are suffering from either of those types of chronic illnesses. So the county, Dona County, started, we are a participant in the National Stepping Up Initiative. And the goal of the Stepping Up Initiative is to reduce the number of people in jails that have a serious mental illness. Because not just here, but nationwide, people with serious mental illness are overrepresented in jail populations. So I was able to work with the group and say, how do we look at our behavioral health system, our crisis response system? How do we focus on this population of people that are also involved in the criminal justice system? And how do we create a different pathway? So the group did come together, and as a result, one of the areas within the criminal justice system where people can be diverted or intercepted out of a criminal justice system and into a treatment system is during reentry. So as they're released from the jail, how do we capture and provide services and support immediately upon release into the, release from the jail and get them connected to adequate behavioral health services. So that's where we're going with reentry. About 4 years ago, the county built a structure, so we have a physical building. And it is right here where we're at today, and it is right next to the detention center. So just across the parking lot is the detention center. So it makes it an ideal location for people leaving jail. We don't have a transportation barrier. Communication with the providers inside of the jail can be very, very seamless. So the idea is, as people with serious mental illness are identified in the jail and are released from jail, this would be the transition center. So they would physically come here, be wrapped in services, medication, maybe some stabilization, because sometimes people are in the jail for just a few hours, and so they could still be in crisis. So we need some stabilization and observation, brief assessments and interventions, and then a lot of work around coordination of care, crisis navigation, and warm handoffs. Molina has provided almost $400,000 for us to start up the reentry system, reentry services here at the Crisis Triage Center, which is really giving us the push to keep moving forward and some resources to actually bring operators into the building and begin providing care for people.
Well, this program is, I would say, very unique and individualized for southern New Mexico and Dona County, and it's essentially a program between Molina Healthcare and AMR to provide what we call community paramedic services or mobile integrated health for members of the Molina Healthcare organization or insurance plan. So in a nutshell, really the program is going to allow for AMRs, EMTs, and paramedics to go out and provide education. And it's really going to focus on trying to help target specific chronic illnesses or issues that those members may have that we EMS are uniquely suited to help them with. Those services are going to be some of the same things that we do today as EMTs and paramedics when we get on the scene of an emergency. And they include a basic and an advanced life support assessment of the patient. We will take vital signs, we'll check blood sugars, we will monitor oxygen levels. We can even take EKGs and transmit those EKGs to the patient's primary care physician so that that individual or cardiologist has an idea of what's going on with the patient once they're discharged home. So right now we're seeing a lot of opiate use really across the country, but especially also in southern New Mexico and Dona County. And again, opiate overdose or opiate use and abuse is not something that's new to EMS. And so we're uniquely suited also in this realm to be able to really interface and have access to people who are abusing opioids. And our hope is in combination with the Molina program to be able to help educate about Narcan or naloxone, help maybe distribute Narcan and naloxone to the family or the individual themselves for use if another overdose should occur. And really we found that, again, EMS is successful in being able to interface with people because people don't see us as law enforcement, because of course we're not, and we're really part of the healthcare team, but we're so accustomed to doing or providing healthcare in the streets or out in the field. And the Dona County Institute of Wellness has really helped bring all those resources together so that there is a central hub for bringing projects like this together, so we can really collaborate to improve the healthcare outcomes in specific populations.
We realized that there's quite a shortage of us, and it's a bit overwhelming for us. I mean, in a single day we can get 12 referrals in a single day, and that's a huge number of referrals for a psychologist to receive. So we really want to maximize our ability to care for people. And what I'm finding is out there in the community, they're looking forward to, there's different clinics and organizations that are looking for creative ways to meet the needs of their populations. What's exciting is with the telemedicine platform, we are able to serve rural areas, urban areas, frontier areas by plugging in those clinics, connecting them, using the internet to the clinics like we have here with docs that are providing care for a more traditional practice and folks in the lobby. Molina has given us the opportunity to do telemedicine, to team up with them and to meet the needs of their subscribers and their consumers throughout the state of New Mexico. So Molina has been involved in really helping us get it right with the level of care that is needed and matching us to clinics where consumer need is high. And so that opens up our ability to tap into resources of other psychologists and to take care of populations that wouldn't typically have access.
My name is Dona Sanchez, so I'm the Southwest Region Director for the Public Health Division of the New Mexico Department of Health, and we cover 8 counties in the southwest corner of the state, and we have 10 public health clinics that we manage as far as budget, staff, programming, and all those communities. We have a very large geographic area that we cover. We have several rural communities. We also have actually a frontier county, Catron County, which is extremely large with very few people. So one of those areas, barriers to really services is one, just access to services through transportation. And so we have a lot of partnerships that we provide with other providers in those communities too, but transportation is a big barrier. So we're real happy about this opportunity with Molina to really improve telemedicine services actually throughout their region. So 2 programs that we're working with Molina on too is really to focus on improving access to family planning services, specifically the LARCs, the long-acting reversible contraceptions. Also really looking at our teen population in that respect. And then the other program is our Suboxone program, which is an opiate addiction prevention program that we have based out of Las Cruces.
We provide family planning services, and we have other clinical services as well, like sexual transmitted disease screening, testing, and treatments. In those clinic areas, we do have 10 clinic areas that can be kind of a 2-hour or more drive for a provider or for clients. Sometimes the access to those services is kind of difficult for them. So with the telemedicine with Molina, what we'll try to do is provide the services without having the transportation. In those clinics, what we're going to use the telemedicine is having the provider see and talk to the clients over the telemedicine, over the LARCs, and provide the counseling if it's to their needs. And then they're going to reschedule another appointment whenever the provider is in person in those sites. They can provide the LARCs.
I'm Patrick Stafford. I'm the program manager for the Southwest Pathways program, which is a behavioral health program that focuses on substance abuse treatment. And we sort of specialize in opiate addiction. Currently, we have about 150 clients, and they are from all over the area, from Deming to Chaparral to Ruidoso and Truth to Consequences. We've had clients in the program for 6 years or more. It's dependent on their comfort level when and if they want to get off of all substances. That's the decision that we try to make with them. We don't dictate to them what treatment is going to be.
So when people think about the fire service, they think about people responding and putting out fires. And that makes perfect sense because we've been doing it for generations upon generations. We have the knowledge, skills, and abilities with which to mitigate those situations, and we're very efficient at that. But one of the things that we noticed is that we were responding to fewer and fewer fires with a sharp increase in calls for medical service. And that's okay. We have 30 paramedics. We have 2 squad ambulances. We go to people's homes. We mitigate their emergency medical situation, and we're very effective at doing that. But what we noticed is that people are not calling 911 because they're having an emergency. They're actually calling 911 because they're seeking access to services. Specifically, they need transportation to go to the hospital so they can see a physician. And they use this as their primary method to access health care. And that's not really how the emergency medical system was designed to work. So in response to that type of a situation, the fire department created mobile integrated health care. So what is mobile integrated health care? Well, in mobile integrated health care, you bring health and human resources to the public in their home. You focus on that underserved population that utilizes 911 to obtain services that can be best obtained elsewhere. We go to their home, we loop in the resources needed to improve their quality of life, reduce 911 utilization, hospitalization, and improve their wellness. Well, we are very excited to potentially have a partnership with Molina. We recognize that in order to expand, we need to be partnering with various agencies because there is a need there that is not just for the fire department, but the other healthcare agencies such as insurance companies and hospitals. They're seeing the same people that we're seeing, and they're not engaging the healthcare system properly. So there's a definite need on all parts for these types of services that we provide.
So Molina's proud to be honored to be working with the Dona Institute of Wellness. This partnership helps us build access for our members, especially who live in rural communities or who have complex or chronic health conditions, and particularly behavioral health issues. So as an organization, the goal of Molina is to provide quality healthcare services to members who are receiving government assistance. One of the benefits of this partnership with the Institute is that this is one of the ways that we work with diverse groups across the state that help us create and expand and support new models that deliver better care not only to just our members, but to all New Mexicans.